Hi, welcome to our Trinity Chiropractic Patient Resource Library. Today we're going to talk about your feet and how your feet impact not only problems in your lower extremity, but also your back. Now, feet end up being a problem for most people at some point in their lives for, I think, two main reasons. One is the footwear that you wear is probably not supportive for your feet for the job that they require. And the second thing is most people are standing on surfaces all day long that are extremely hard. They're concrete, tile, hardwood, pavement, that they don't allow the feet to properly work through their proper motion. So we'll talk about that a little bit today. And we'll also talk about some of the things that you can do on your own to increase the longevity of the functioning of your foot and ways to address some common foot problems as well. First things with the feet, most people are probably already aware, there's two main arches to the feet. There's a longitudinal arch, which we typically think of as being our arch, and then there's our transverse arch, which happens across the toe area at the ball of the foot. Another important thing that we see with the feet is most people don't stand properly with their weight on their feet to minimize stress on these arches. And you probably do this as well too, because I find most of my patients do this. When we stand, we tend to bring our pelvis in a forward position, drawing our weight into the front part of our foot, and then we feel pressure on our toe box. If you notice that you're doing this, I would ask that you just lightly flutter your toes and try to see if your weight shifts backwards to the point where you're feeling more stress directly underneath the ankle area. You might also notice that your lower back starts to become more engaged because your alignment is becoming more vertical as opposed to zigzagged through that type of a posture. So when there is a loss of the functioning of the foot or excessive stress on parts of the feet that are not designed for it, we can impact how your foot structure will impact other parts of your kinetic chain, meaning your legs, your hips, and into your back as well. When the arches become dropped, or if we lose support through those arches, our legs are going to start to excessively rotate internally. What that means is your shin will be drawn in. That in turn will bring your knee in and rotate your hips in at the same time. Along that continuum, you may find that you have a knee problem as a result of your foot problem. So that's something that you can bring up with us when you do come in for a visit. But I want to talk about two common things that do occur with the feet, conditions that we see quite commonly. One is called plantar fasciitis, and the other is called Achilles tendonitis. Where they occur is in different areas, and the mechanism for causing them can be similar in both cases with a couple of subtle differences. If you have plantar fasciitis, you may notice very sharp pains on the bottom of your feet between your heel and your toe area when you first start walking after a period of rest, particularly after sleeping for many people. With Achilles tendonitis, the pain is usually localized to the back of your heel, usually at the point where the top of a low-cutting shoe will come into the back of your ankle area. And that might happen through excessive activity. If you have either of those conditions, it may be because you've seen your arches collapse, and that can happen over time. Many people, it won't happen until they're over the age of 20 or 30, in fact. Some simple things you can do at home to address that, to address the symptoms, but not necessarily the cause, so you might get some short-term relief with these things, are to aggressively stretch both of those areas. In our office, we have the TheraBand foot roller, which works wonderfully well to aggressively stretch the bottom of your feet. Some people will use their thumbs to dig in and work longitudinally or lengthwise across your foot, looking for little nodules or tight grains of sand, almost like in texture, that you can work through to stretch that out. If you have the Achilles tendonitis, that as well can require some stretching around that area, being very careful to the sensitive portion of the bone at the back of your foot, not to exert too much pressure through there, but you can be stretching out the back of your calf as well. A lot of people will tend to do aggressive stretching on the bottom of their foot by placing their foot against the wall and drawing their foot in towards the wall at the heel. At the same time that you're doing that, You can straighten your knee or have it bent. Do both positions to effectively stretch the back of your foot and also the back of your Achilles and your calf muscle at the same time. Okay, and some people might require, if they're not able to achieve success with that, correction of the problem itself, which might be a change in your arch structure of your foot. The only device that addresses that appropriately is a custom-made orthotic. Custom-made orthotics are something that we make in our office that if you are interested, you can talk to us directly and we will guide you through the process of making a device that will increase and improve the functionality of the arch of your foot. I hope you found this video helpful. If you want more in-depth information on this at your next visit, feel free to ask me about that. I'd be happy to help.